Xiaflex has many benefits compared to surgical excision for Dupuytren's contracture. Use of this enzyme with a simple injection technique results in tremendous healthcare savings, improved efficacy, and quicker return to activities compared to typical surgical treatment. The benefits are as follows. This procedure can be performed in the office. The simple injection technique avoids the risks and cost of surgery and anesthesia. The injection is quicker to perform than surgery. Patients typically have less pain and discomfort after the injection compared to surgical treatment. The recovery period is shorter than surgery, and patients can frequently resume all activities within 1 week of the injection, depending on the severity of the contraction before the injection and whether or not they develop a skin split. Most patients require extensive and prolonged hand therapy after surgical excision. It is rare for patients to require hand therapy after the simple injection technique. For the first 144 patients I treated, representing over 200 separate diseased hands, less than 6 patients required hand therapy. Patients avoid multiple extensive incisions in the hand and fingers to remove the diseased tissue. I liken surgical treatment of Dupuytrens to the Frankenstein hand, given the typical appearance after surgery. Dupuytren's is a disease. The data shows an approximate 50% contracture recurrence, both with surgery and with collagenase at 5 years. If a patient had Xiaflex and the contracture recurs, it is very simple to inject again. If Dupuytren's contracture recurs after surgery, it is very difficult to operate a second or a third time because of scar tissue. However, even in this setting, I can still typically achieve very good results with Xiaflex. And lastly, after the injection and after the swelling disappears, the hand looks completely normal with soft, supple skin, no scars, and typically no evidence the patient ever had Dupuytren's. There are some potential risks. Collagenase injection is a surgery. However, I use an enzyme as opposed to a surgical scalpel. Every patient, 100%, will develop swelling, bruising, and tenderness. There's an increased risk of swelling and hematoma for patients on blood thinners. 20 to 30% of patients will have swelling, bruising, and sometimes tenderness in their upper arm or armpit. Collagenase is a foreign protein, and sometimes your body develops a histamine response to this material. This is not uncommon and will resolve with conservative care. Xiaflex is a powerful enzyme that can do amazing things. However, if injected into the wrong place, bad things will happen, including the potential for tendon rupture. Fortunately, this is what I do, and I have done over 1,000 of these injections. With careful technique and good knowledge of anatomy, this enzyme is safe and reliable. Given my extensive experience, I feel comfortable safely injecting this enzyme into areas of the hand and fingers that most hand surgeons do not. These more difficult to inject areas, however, frequently give the best results. While there are risks associated with every procedure, the Xiaflex simple injection technique allows me to inject multiple cords with 1 bottle of enzyme and achieve very good results. I am a big fan of perfection, and I strive to achieve that with every patient I see.